So, over the past year, certainly things have shifted with the advent of telemedicine in the field of MS. So, telemedicine has been very widely used in some fields of neurology, primarily for stroke in the past, but has not been used very effectively for MS. So, much of symptom management, especially for those visits in between big MRI visits, have really been done via telemedicine. And so, it's been a very convenient way for patients to reach us, certainly a convenient way for us to be able to talk to our patients. However, can be limited because of technology issues, but also because we can't do as good of a neurologic exam. But symptom management, as I said, in some ways has become a lot easier during the pandemic. So it definitely has had some effects on rehabilitation. I would say since the pandemic began, many patients have been hesitant to participate in physical therapy, especially because often there's not a lot of social distancing. There may be several people there at the same time working on the same equipment. And also, when people have been homebound and had someone come into their home, there also has been some hesitancy to allow people into their home. So I would say that definitely has been much more limited since the pandemic, but things are starting to open up again. So I hope that telemedicine is here to stay. This hybrid model has really been advantageous for many of our patients for a variety of reasons, some of which we discussed, but also just the fact that if someone has a quick question, I had a patient who was having a side effect, and I was able to just log on to a quick telehealth visit and address that, very efficiently. Also, one of the other challenges is that oftentimes, as physicians, we do want to be paid or compensated for our time, and we don't often get paid for things like phone calls or other time with paperwork. So we're able to not only see the patient, address that thing face to face, but we also can be compensated for the time that we spend addressing that. I think the other piece is that I've also had, instances where a patient would be scheduled for an in-person visit and maybe they weren't feeling well and they weren't able to drive themselves. And we were able to convert that to a telehealth visit, to be able to address that issue and to still see them and communicate with them even when they didn't feel like coming in, instead of them waiting another 2 or 3 weeks or another 3 months until we have another opening to be able to do that. So I think that it affords for flexibility for both the patients and for the providers who are providing the care. The other thing that I hope still stays is this collaborative approach amongst MS specialists, general neurologists, and my colleagues around the globe. There has just been this amazing, unity amongst everyone to try to find the scientific answers we need to be able to adequately care for our patients. And so we've seen a lot of synergy with people creating registries fairly quickly. A lot of things that we thought couldn't get done are absolutely getting done. A lot of things we thought couldn't be done remotely are absolutely being done remotely. And so I hope that some of this continues to move forward so that we can adequately care for our patients and have the best up to date information to do so. I think the only other thing I would say is that something else that I hope that will come out of this is, looking at health disparities and recognizing that these are an issue. I hope that the momentum continues to try to address and better understand why we see disparate and poor outcomes in underserved populations. And I also hope that some of the work that we've been doing with telemedicine and remote work will translate into some of our clinical trials. One of the biggest issues with enrollment in clinical trials is that they're often very burdensome in terms of time. And so if there are ways that we convert some things to be able to have them done remotely so that people don't have to spend as much time in person, I hope that this is a positive that comes out of this hybrid model of care as well.